June 4th. I'm going in for carpal tunnel surgery at the Pembroke Regional Hospital. Hopefully this goes well and I can play guitar soon. So just got out of the carpal tunnel surgery. It took about 20 minutes. This is the wrap, and what I can tell you is my index feels good. The middle finger feels pretty good. The next one, the ring finger, is extremely picky. And the baby finger, surprisingly, is picky, since it doesn't get picky with carpal. And the thumb feels good. So these three are feeling good. The thumb, index, and middle finger, and the baby finger and the ring finger feel a little picky. They've told me to come back in 7 days to remove the stitches, and the other bit of information that I was concerned about was how long before I could start playing guitar. And they told me as soon as the stitches are out next week to start using the hand as much as possible. So that's good news. So as of, it looks like 7 days, and then I'm going to be definitely playing guitar and seeing how this works. Almost 48 hours, getting close to 48 hours since I had the surgery. Surprisingly, my hand is sore, more sore today than yesterday. Yesterday wasn't bad, actually. On a pain scale, I would say it was around a 2. Today was around a 5. So that's interesting that it actually got more sore, more painful. I'm gonna actually take a few Tylenol. Okay, so it's a Thursday about 1 o'clock, and I've had to take the band-aids off. The bandages, I don't know, it seemed like it was swelling my hand or cutting off the circulation. So I know I was supposed to keep them on till next Monday, but I need a break. So you can see the hand is definitely swollen pretty good on the back, which I find strange since the surgery was on the bottom. Now, the interesting thing is that it doesn't really hurt at the incision site. It hurts on the top of the wrist here and through here where this swelling is. That's what's been hurting. Definitely can't move my fingers as good as yesterday or the day before. It's Friday morning, 4 days after carpal tunnel surgery. And again, I wanted to make this video just to show the progress of the surgery and the outcome of the surgery. I know many guitar players or people that use their hands, especially musicians, have concerns about doing this kind of surgery. I know I did. I was concerned about, what would be the outcome? Would I still be able to play properly? How long would it take before I could play? Would it affect my movement? I read all the pros and cons, like everybody else, on who are considering this, I'm sure, on the internet. And, some people are very apprehensive to get this done. So I got to the point where my fingers, every single finger from, the last joint up, were sleeping or tingling extremely bad, and my fingers were feeling like sausages. So it's that feeling when your hand goes to sleep, except you can't wake it up. So it was driving me absolutely crazy. So I made the decision to get this done. So the progress for today is my hand is still swollen. I don't know if you can see that. Now, the swelling is all on the back. The incision area does not hurt whatsoever for me. I removed the bandages, even though I was supposed to leave the bandages on. They recommended till Monday when I get my stitches out. I removed them because the swelling was getting so bad that it felt like it was cutting the circulation off. So I removed the bandages and got a little bit of relief by removing them, Then I also took prednisone. I have access to prednisone. So I took, three prednisone tablets, which are 5. So I took 3 yesterday, and then through the night as well, I took another 3 through last night because my hand was starting to get sore again. But generally, what's going on now is my hand is not as sore. So the swelling has receded a little bit, and I think that was partly due to the prednisone. Prednisone's a great drug for bringing down inflammation. Okay, so I'm going to pick up guitar for the first time, and first of all, I can't lift any. I couldn't even hold this guitar up with my hand. There's no way. Yesterday, it was difficult to pick up this water bottle. I couldn't have picked that up yesterday. So let's just see if I can make any chords or what I can do on the guitar. So okay, no. So I'm trying to play a C chord here, and I have no real strength to push it down, and I think what's happening is the fingers are swelling, so it's not allowing me to make because they're swollen, it's not allowing me to make the chords properly. There's a G chord. Well, at least I can play the chord. Yeah, I'm gonna try it in a different position. Yeah. So I can make the chords, just don't have a lot of strength to push them down. Let's try a bar chord. Okay. There's a 7th. So I don't have a lot of strength to push them down, but anyway, at least I can sort of make them. Oh. Okay, so yeah, trying to stretch to the baby is a little bit tough. Okay, so I can at least get the fingers moving, and that's probably what I'll do, is just do some fingering, some finger exercises to build up the strength, and over the next few days, for the next little while until I got my strength back. Okay, bending notes, impossible. No strength to push the note up. Update, it's Saturday. Hand is still swollen, again on the backside. Incision, no pain at all. Fingers are moving, I can actually touch the tips. The stretch to the baby is still difficult. On this side I can obviously go past the baby. And that's probably restricted just by the swelling. So hopefully the swelling comes down, and I can get these fingers moving a lot more. I think it's healing up though. I think the swelling has gone down a little bit since yesterday. I'm supposed to get the stitches out today. I'm actually waiting for the doctor. That's what it looks like. And I can just tell you that the last 2 or 3 days, since Saturday night, Sunday, the hand was definitely more sore and had less mobility. I would say the pain level was the worst since the surgery, which I find interesting, because it was done on Monday and it progressively got worse. So Saturday and Sunday, I would say the pain level was around a 6. You definitely needed to take some Tylenol, so I took Tylenol. And today it's not too bad, but the stitches are coming out. So that's the update for Monday morning, 7 days from the initial surgery. So this is 8 days after surgery. I had the stitches out yesterday. There was a total of only 3 stitches. Doctor said that the wound looked fine, and it did look good. He checked my fingers, asked me about tingling. There's a slight tingling, not much, but there is still a little bit of slight tingling. He said that should go away. This is a pretty good sign if it's not, there's not too much tingling. So the hand is, it's still swollen a bit, but not bad. It is still sore, but dramatic improvement over the last day or so. Last night, the pain was around 4. I did have to take some Tylenol to get to sleep. Or I woke up in the middle of the night and it was pretty pretty sore enough that it was, keeping you up. So I took some Tylenol, got some sleep, and the hand feels a lot better today. So one thing, I can definitely make a fist. I can't squeeze it hard or anything, but look, I can make a fist. That's fantastic. I can actually reach over and touch my fingers. Not as far as I normally could, but it's coming. So let's do the guitar test, see if I can play. First of all, I can actually pick the guitar up with my hand. I couldn't do that 2 days ago. So, not well, but I can pick it up. So let's flip it over. And, okay, so I'm already playing a chord. Now, my fingers do feel a little bit swollen. But I can make a chord, Okay, so chords, can I get to a B minor? Yeah, it's not pushing I would like to, but so I'm getting into bar chords, and I have medium amount of strength. I wouldn't want to do that changing quickly. I think that'd be hard. So I'm getting a bit of pain right here when I make those chords, but ow, okay, a little bit sore, but let's try individual notes here. Okay, bends are still difficult, but hey, I'm pushing them up. That's something. Thursday, June 16th, and this is 3 days after I got the stitches out. So I got them out Monday, Tuesday, Wednesday, Thursday. And I'm back to a swollen hand. And this is my fault. Monday, the doctor said, start playing guitar, strengthen up the fingers. And I'm certain that he meant a little bit. On Tuesday, I overdid it. We had band rehearsal, and I played along to maybe 10 songs. I could make the changes, no problem. My fingers were pushing down the chords, not well, but I was pushing down the chords. I was actually doing a bit of lead. And anyway, the guys, against the advice of the guys in the band, they said, you're pushing too much. And again, I was anxious to play, but I paid for that. So Tuesday night, my hand was swollen, and the pain was as bad as it was since through the whole thing, actually. So I had to take Tylenol again, and yesterday, it was sore all day with a lot of pain and throbbing. And Thursday, the pain subsiding. I still can't squeeze well. My fingers are still swollen, and the hand is, pretty swollen still. And that's 2 days after. So a word of advice: don't push too much after when you first start playing. So it's a full 2 weeks since I've got my carpal tunnel surgery. Let's see. Over the last 2 days, over the weekend, Saturday my hand was still sore. They were still. I took Tylenol Saturday and Sunday in the middle of the night. Again, it was still sore. What I noticed yesterday was my hand has definitely got weak. So, I've been trying to make a fist a lot now, and I'm starting to do it pretty well, because it was getting to the point where I could only bring to here. I couldn't squeeze. So honestly, today it's it's feeling a lot better. There's still some swelling. Now here, I took the Band-Aids off yesterday. And so you can see there was 2 cuts. I don't know how well you can see that, but there was 2 cuts here. And this part of the thumb feels very dead, as though the nerves have been affected. Maybe it's just the stretching or the pulling. All in all, a little bit of swelling, but getting better, no question. So let's just pick up the guitar. And I think right now the big thing is to push it. Even though there's some pain, I think I have a feeling I need to start strengthening the hand, getting it back to normal. So let's play an F chord. Ow. So playing an F chord, there's definitely some weakness in the back of the hand. Oh yeah, some weakness. So what I'm noticing is right here, the strength is not too good. Even bending, I'm still haven't, it's just not there yet, but it's a hell of a lot better. Still a little messy for sure. Doing stuff like that, it's just not there yet. Yeah, it definitely hurts still when I do that. But let's do bar chords. Ow, yeah, still some pain. It's not really pain. It's more you go to do it and you get a pull, and it kind of startles you. So at least I'm playing guitar, not well, but I can feel the big thing now is just to bring back the strength on the hand. I could lift things now, which I couldn't do 3 or 4 days ago, but it's still weak. So once I get the strength back, I think I should be just fine. As far as the tingling, I'm not really experiencing any tingling anymore. There's a lot of pull in here. You know, even have some lines here. It's like, I think it's just being pulled together. And, but that's it. Okay, now I've got a squeaky chair. Today's June 26th. It's my birthday. Yay. And let's see, I got the carpal tunnel surgery done on June 4th. So today's June 26th, so that's 24 days, no, 22 days, 22 days. So that's three weeks and a day. And how's the hand? Well, let's see. First of all, here's the incision. I don't know if you can see much. So it's, you know, it's pretty good, and just not very much pain at all on the incision site. Pain definitely in here, pain in the wrist, pain in the back of the wrist. Last Thursday, I rehearsed with our band for a couple hours, played guitar at about an 80%. You know, couldn't press down certain things, but anyway, the bottom line was that night, my hand really wasn't that sore. So I thought, that's great, you know, things are looking up. However, Friday and Saturday, today being Sunday, Friday and Saturday my hand got really sore and throbbed even through the day, through the night. I had to take lots of Tylenol again, it all swelled up. I think that came from using my hand more with different motions. So I actually, you know, twisting a jar top off, I couldn't even do it. I had to get my wife to do it. Jesus. And what else? On yesterday, I went swimming. It was like 35 degrees Celsius here, so it was steamy, pretty damn hot outside near Ottawa, Canada. And jumped off my pontoon boat into the water, went to get up the ladder, and there was no way I was pulling myself up the ladder with this hand. It was just too weak. I had to use my arm and pull myself up that way. So it doesn't have, you know, full strength, that's for sure. I probably couldn't even lift 20-pound weights at this point. 10 pounds, yeah, maybe 15, but 20 pounds, it just doesn't have that lift or that pull. So anyway, as far as guitar, first time I picked up the guitar. So I have a performance in 4 days, June 30th, followed by another one on July 1st. So I've been trying to get this healed up for these performances. So that gave me 26 days to heal. And let's see, so F is not bad. Now I'm using, just playing around here, an electric guitar, so a little bit easier than acoustic. So this bend here, you can feel the pull even in the incision and the thumb for sure. It's not back to normal. Okay. Hand's not quite back to normal as far as precision goes. So still definitely, I'd say it's about 80%, 85%, very weak still. For doing bends, vibrato's okay. But the bends are coming. You know, doing any speed stuff is still not there. Okay. Chords, bar chords are easy, especially fifth. B minor, a little bit of strain, not bad. Okay, a little bit hard to do that, but you can do it. So it seems to be the initial movement, but then once you get rolling, it seems to be okay. Anyway, yeah, definitely strain, lots of pull in here. So I've got 4 days. Hopefully I won't make too big of a mess during these performances coming up. I'm sitting in the Walmart parking lot waiting on my wife. So I thought I'd do a quick update on my surgery. So the carpal tunnel surgery was June 4th. Today is July 4th, so 1 month. This is the 4-week point. And by the way, happy Independence Day to all the people watching from the U.S. July 4th. And July 1st was, I'm in Canada, July 1st was our national holiday, so it was a good day. I played that night, so I played an event, and my hand was actually doing quite well. I did well. My fingers were moving pretty well. And let's see, the day after, my hand was okay. But the last 2 days, really, my hand has been throbbing. And it's been throbbing and stiff, probably worse than the entire, the whole ordeal. It's more painful now than day 1, day 2, day 3. So I'm not really sure why. It hurts the incision. If you look, the incision looks pretty good. It's healed up quite nicely. But in that thumb area here, the side of my hand, the wrist in here, and up in here, and literally the back of my hand, really the whole hand, is now throbbing. I haven't taken any medication, but it's weak. It's got no strength. I was picking up a 10-pound barbell and a dumbbell, and I was moving it no problem up and down. I didn't try the 20s or 30s, but the 10-pound was actually working pretty well. And now I couldn't, there's no way I could pick it up again. So I don't know, it's just my hand is weak. Even opening the door handle on the car is difficult. So I'm not sure why I got this temporary setback. I was talking to an orthopedic nurse who said, move your hand a lot, and I have been. I've been playing guitar, I've been using it per normal, and treating it normally, like trying to do everything with my hand, but now it's just throbbing. So anyway, hopefully it's a temporary setback, and I'll be okay in a few days, but I'll give you guys a report in a few days. Hopefully, like I say, hopefully it's just a temporary setback and things will be fine. Now it's July 10th, like I say, and this week I can tell you that my hand has been worse than the last 3 weeks for sure. Probably, or possibly all the way back to the third or fourth or fifth day. So I don't know why, but my hand is much worse. It's been swelling, particularly in here. Okay. It's sore in here and here and the entire wrist. Now the fingers feel okay. The surgery looks, it's healed up and it doesn't really hurt too much in there at all. It never really did. It's all been in the wrist and the hand here. Okay, so you can see the swelling. What I've been doing is I want to pass this on. This is a great little technique. So I picked these up, these ice packs, and they're flexible. So they get cold, you put them in the fridge, they get cold, and you wrap them around your hand, okay? Now, what I use these for compression. These are terrific to give you a bit of strength. Sometimes you just need the feel of the compression, so you can use those. But what really works well is when your hand is sore, wrapping that around, and you can hold it in place with the Velcro. So that really works well for keeping the ice around the entire hand. So I have a couple of these and I alternate them. So I just wanted to show you guys that. Getting back to playing. So I played on June 30th, and like I say, my hand was feeling much better. Flexibility was good. I mean, it was a little weak. I couldn't do super stretches, but I played for 3 hours. And things were okay. And the next day, my hand didn't really hurt that badly. So I thought, things are great. By next week, it'll be even better. Now that was a misjudgment for sure, because a couple days after playing, my hand got really sore again. I would say it relentlessly got sore. So on a scale of 1 to 10, 5 pain. So not intense pain, but soreness all the time. Keeps you awake. It's just always sore, that lingering soreness in the hand and the swelling. So my hand also got very weak. So even picking this guitar up right now, that's difficult. That is really difficult. That's, quite frankly, it's frustrating and pissing me off. So I've got electric because I can't even press down an acoustic very well. That's just shit. So even doing a basic scale, major scale, I can feel the strain in here. Okay, doing chords, I can feel the strain in here. I don't know if I could change them quickly enough. Okay, so definitely lots of strain. Bending's actually not too bad right now, but again, it seems to be chords or long stretches. Yeah, that's so lots of strain here. I could not do any of that on acoustic. Like I said, I can barely push the chords down. The electric is certainly more lenient. So right now, just from that little bit of playing, I can feel my whole hand in here getting very, very sore. and I wouldn't be able to do that long. Okay, so this will be my final video. It is almost 10 weeks since I got the surgery. Today is August 12th, a Friday, and on Monday it will be 10 weeks coming up. So the experience. The pain was a bit more than I anticipated. It lasted longer. The healing process took longer than I anticipated. Now I'm certainly glad I did this, bottom line. I can tell you on the 6th week, almost to the day on the 6th week, my hand got extremely painful. My hand, I couldn't close my fist again, so it was improving. I thought, okay, this is all getting better. And then on the 6th week, for whatever reason, I had extreme pain. I would say more than any time in the first 6 weeks, or the whole event. That was the worst few days. My hand was incredibly painful. And like I say, all my fingers swole, and I didn't really do anything differently. So if I look back, things were getting better, and then all of a sudden on the 6th week I had a relapse, and that lasted about 2 days, and it was a bit concerning because it's like, wow, what the hell is going on? But then it just started to improve, and 7th week, 8th week, everything started getting much better. So let's see, from a guitar perspective, I'm, everything's much better for sure. No more issues. The only thing I would say is I was playing some slide guitar, and I was up here on the 17th fret, and I had to really bend my hand around like this, and there's still a bit of pulling in here, so it's not quite back to normal here, but no real issue any longer. So bending is fine. A little bit pulling still here in the back of the hand, but not bad. So one thing I can say is I'm glad I had this done. There is no more tingling in my hand. And I mean, my hand was falling asleep. It was virtually unbearable. It was driving me crazy. So any of you guys with carpal tunnel issues, you'll know, when it gets severe, you'll know, how that'll drive you absolutely mad. So bottom line for me, the surgery was a good decision, and I'm glad I had it done. So with that, I hope it helps people with their issue, whether they want to do it or not, but it was successful for me. And again, bottom line is I'm glad I had the surgery. So hopefully this helps you guys make your decision. And hopefully if you do choose to have the surgery, that your carpal tunnel issues will improve like mine. Anyway, take care.